Då går du upp, eller? Ja. Dear colleagues, dear friends, health comes from within. That is an expression people tend to use, but as we all know, the truth is more complex than that. The initiative for the Uppsala Health Summit sprang from the insight that the big health issues of our time must be approached from many angles simultaneously, and that there are good reasons to work with a broad, multidisciplinary perspective. The format has, so far, been successful. This came about because we saw in this collaborative project that there are reasons to work more broadly, cross-border and interdisciplinary around our major societal challenges that touch and involve the area of health. This is the 9th summit, and already several of the big issues of our time has been on the agenda in this context. Pandemics, child obesity and cancer, to mention a few. And we can also see how the themes are connected. It is no big surprise. Our planet and humankind are part of one big closed system. We reap what we sow. All comes back to us and affects us all, sometimes noticeably, sometimes on a smaller scale. How is often hard to predict. To address this complexity, we must use all the knowledge there is that we have in a smarter way. The goal of these meetings is for us to use the knowledge available in a wiser way. We must make an impression, influence policies and politics. Questions about how to create a healthy world concern us all, and wherever we are in the world, we are looking for answers. That unites all summits. Likewise, they are united by the realization that the more we know, the more complex the picture becomes. Much needs to be sorted out. Which regulations are needed, which problems can be dealt with quickly, and where is the state of knowledge sufficient or insufficient? What can you and I do to contribute to better health? We all need answers, and many of those answers can be found here. Those of you in attendance here have the collective knowledge required to help humanity progress. You are also aware of where the knowledge gaps lie and which areas research needs to pursue vigorously. You won't be able to realize all of those plans here at Uppsala, but you will have the opportunity to meet, converse, make contacts, and discuss collaborations. It is the here and now that matters. During these 2 days at the Uppsala Health Summit, you will take part in dialogues where you will help develop steps into concrete actions that will matter to everyone in your countries and communities. You may be in a position to influence policy, be part of a grassroots movement that works for change in attitudes, a researcher that helps us build the evidence base, or somebody who can influence decisions concerning what we eat. The aim of the Uppsala Health Summit is always to bring some of the best minds in the world together to address challenges and dilemmas in order to improve global health outcomes in all parts of the world, also when resources are scarce. That is why you are chosen and invited to be here. The summit is an arena for active dialogue. You are invited to share your experiences, views and ideas in plenary sessions, around the tables, in the workshops and during breaks. Before formally declaring Uppsala Health Summit 2022 open, I want to introduce you to our conference moderator, Louise Hård av Segerstad, who is a resilience expert and communication strategist. She is the co-director of Alba Eco, an independent non-profit organization with the principal partner Stockholm Resilience Center at Stockholm University. In conclusion, welcome to Uppsala Health Summit 2022.
Thank you, Anders. I'm honored to have been asked to moderate this the plenary sessions of this great summit that gathers this excellent combination of people, great hearts and minds. First, I'd like to give credit to the beautiful dance performance. So we saw the theme, the dance was under the theme Sustain, and it was performed by Evgenia Kadzira, Uni Stewart and Zala Pesdir. And Zala Pesdir was also the choreographer of this dance. So we will have 2 days full of conversations here, and you all found your way here. Or those who didn't, we haven't seen them yet, but we hope there's no one lost. But so some directions to find your way in here. So this is Rikssalen, where we're gathering for plenary sessions. Just outside in the passageway where you came in, there will be coffee and tea served at the breaks. Restrooms, there are 2 areas. Both of them are unisex. One is halfway downstairs, and the other one is at the bottom of the stairs if you sort of continue under the stairs. So there's plenty of room there. I will come back later for the workshops rooms and give you directions to those. Other things to know is the emergency exit. So one is out the stairs where you came in, another one is out this way, and a third one is out this way, and they are all signed with those green shining signs. We hope we don't need to use them. There is also the defibrillator, very difficult word to say, but it's found here in this corner, also something we don't want to use, but it's good to know where it is in case. So, the sessions here in plenary will be live streamed, and you are more than welcome to share through social media, and we have 2 hashtags that you can use. One is Uppsala Health Summit, write it out, the whole one, and the other shorter one is UHS, and it should also be a 22 there. So this one, but with a 22. If it's not changed, now I get confused here, because now we have different messages here. If I'm wrong, someone scream. Otherwise, I think it should be UHS 22. No one's screaming, so we take that as a confirmation, UHS 22. So you're more than welcome to share what's being said and done in here. When you're in the workshops, we instead invite you to stick to the Chatham House rule, which is you are free to use the information received, but neither the identity nor the affiliation of the speaker should be revealed. And that is, you can share what's been said, but don't share who said it or from what organization they came from. And this is to allow speakers, to allow everyone to speak also as individuals and not always having to express the views of their organizations. It allows for a more freer discussion. Then there is also, to help you share on social media, there's a free Wi-Fi here, so you choose Uppsala Health Summit for the Wi-Fi. And last of the practicalities, there's a conference app where you will have the program available. You can, if you haven't downloaded that previously, you can get help from the reception downstairs where you got your badge, if you didn't get that yesterday. I think that was end of the practicalities. So now I'd like to invite you to share a little around your table before we get into the first plenary speaker session. So I invite you to share, name an affiliation if you haven't had the time to do so, but also to share what do you grow in your garden? What 3 things do you grow in your garden, given you're fortunate enough to have a garden? If you don't, well, share what you would grow if you had a garden. So I give you some 7 minutes for that, so you get a chance around the table. And please also write down on the post-its what you are growing so we can share that. Thank you. Great, thank you. Oh, it felt like that was very loud. Would anyone like to share? What do you grow? There are mics available, so just raise your hand and a mic will come to you. Please share, I'm curious. And everyone else, down there with someone, yeah.
I grow 22 types of chilies, like from 6 to 10 on the scale of 10 for my husband. I don't eat them myself.
So we look forward to dinner at your house if you're fond of hot food. Anyone else? What more do we grow here? Up here from, yeah.
I grow garlic, potatoes, and kale. And I love growing garlic because I have to wait for 1 year to actually harvest it here in Sweden. So that's really nice.
Great, thank you. Do we have one more? Variation. Yeah, here we have it. Oh.
Hello.
Yeah.
Yes, I grow apples, which I leave to rot in the garden.
That's good. And one more here in front.
Thank you very much. I have quite a bit of things in my garden. I have some spinach, some kale, some tomato, a pomegranate that I'm hoping will fruit this year, a lemon that is too young yet to have some fruit. I have a false banana. In Ethiopia, they use the stems that they ferment for a staple food. I have a pumpkin that is not doing very well, but I'm not interested in a pumpkin. My interest is the pumpkin leaves that we eat where I come from in Zambia, so I'm not happy that the leaves are not doing well. I have some mint, I have some celery, and I have a mix of Ethiopian herbs that I don't really know what they're called, but they are nice. Thank you.
Thank you. And also, I would like to include anyone who doesn't have a garden. What would you like to grow?
I'm lucky to have a garden, but I also, I should say, grow things inside. So inside, because I'm based in the Netherlands, we have lemongrass and basil, but my husband is also growing mushrooms on coffee residue, which is actually going really well. So you just take your leftover coffee, put in the mushroom spores, put it in a dark place, and after some time you have oyster mushrooms. Mm. And for the gentleman with the apples, it's very nice to make applesauce. Even if you have a couple of little spots on your apples, you just put them in a pan and let them, boil a bit, and then you can keep it for quite a while.
I don't have a garden, but I work with orphanages to grow fresh fruits and vegetables. So we grow carrots, green beans, and local vegetables for food security throughout the year.
Great, thank you. And we have...
Yeah, I also don't have a garden, and I would love to grow maize, beans, and squash. And that's because they do that in South America, and I would be curious if that works, since the theory is that you will have more proteins and carbs from this combination of plants. So, yeah.
Great, thank you. Okay, was there one more, last one down in the corner to the left?
I have a garden and I have tried to grow vegetables myself, not very successfully. But actually, I wanted to mention that I have also been seeing all those rotten apples in the gardens, and I have contacted the owners and then was invited to go there to pick up the apples and donate them to people who don't have enough food, or also to make applesauce myself, actually.
Great. Thanks so much. Thanks everyone for sharing and for participating. Now we will listen to a great lineup of speakers to put us all on the same page. And hereby I also welcome all participants who are joining us online, so very nice to have you with us. So our first plenary session has the title Food Systems for Health. The goal of this session is to achieve a common understanding of the current state of our global food system and its impact on our health, as well as the transformation needed to secure safe and healthy diets for all. So to start, we will listen to Dr. Francesco Branca. Francesco is the Director of Department Nutrition and Food Safety at WHO in Geneva. Warmly welcome, Francesco. The floor is yours.
Thank you very much. Thank you, and thanks to the Uppsala Health Summit first of all, for selecting this topic. This is absolutely critical at this contingence in the humankind. But thank you for allowing me to be in this fantastic venue. I realize that that's an historical value where your Queen Christine decided to give up. And I think it's an important side because, I think we need to decide when to give up, when time is ripe. So I would like to start by telling you that this summit is about really solutions. And I think it's important to discuss about solutions. But in order to find the right solutions, we need to frame the issues in the right way. And I'd like to frame it in a comprehensive way. So what is the connection between food and health? And on the right side of this slide, you see a number of health conditions which are connected to somehow food. And some of them are obvious, of course, the different forms of malnutrition, the impact of unhealthy diet, non-communicable diseases, but also communicable diseases, and a number of others, including mental illness and certain poisonings. And you see there are a number of pathways. There are multiple pathways of interaction, but we've summarized in 5 pathways. And I'm going to tell you a little bit more about each one of them. So first one is unhealthy diet and malnutrition and food insecurity. Second one is about zoonotic diseases and antimicrobial resistance. The third one is unsafe and adulterated food. The fourth one is environmental contamination and degradation. The fifth one is occupational hazard. So let me start with the first one. You're probably familiar with the global burden of disease. You actually have to go on a website and do the analysis. It changes every once in a while because demography changes, some of the impact sizes change, but this is sort of the latest one. You see that unhealthy diet accounts for 8 million deaths every year, followed by obesity, which accounts for additional 5 million deaths, and then maternal and child malnutrition, 3 million deaths. If you put them all together, it's a third of the overall mortality. So it's actually a major component of the world mortality, largely due to non-communicable diseases, but a lot of them is also due to infectious diseases. Now, I was saying different forms of malnutrition. We are now aware that there's not a single form of malnutrition. Even the Sustainable Development Goals talk about this, all forms of malnutrition. What do we mean by that? We certainly mean that there are some forms of undernutrition, particularly wasting, stunting, which still affect large amounts of population. This is children under 5, so we have about 150 million children still affected by stunting, about 45 million children still affected by wasting, but then you already have, in that very early age, overweight and obesity, and of course, obesity in the adult population, as well as different forms of macronutrient deficiencies. There was just a new estimate of the macronutrient deficiencies indicating that 2 billion people in the world are affected. But we use anemia in women of reproductive age as a marker of this, and you see, about 264 million women affected by the iron deficiency anemia. And then this is a terrible year for food insecurity. I mean, this is the latest report that we published together with the sister agencies FAO, World Food Programme, IFAD, and UNICEF, and it's telling about the state of food security and nutrition in the world. This is a terrible year. I mean, you see the U-shaped curve. It's going up again. We had done progress in reducing food insecurity. Now it's going up again. We have about 800 million, some estimates up to 828 million people who don't have enough energy to eat. And this is just only about the energy. That means 1 person in 10% of people affected by food insecurity. It's a convergence of factors. It's climate change, which reduces production. It's the economic downturns. It's the result of the pandemic of COVID, and now the conflict and the war in Ukraine, and we estimate that additional 11 million people in the world will be affected by food insecurity as a result of the war. The other pathway I told you, actually number 3, but it's about food safety and adulterated foods. And it's not a small number of people every year who are affected by some forms of food contamination. A lot of it is about diarrheal disease and, Campylobacter, Salmonella. Those are the key ones. But we calculate that about 1 person in 10 gets ill every year by some contamination of the food. And that leads to 420,000 deaths, particularly among young children, 125,000 deaths in children under 5, largely to do diarrheal diseases. And can you imagine where this kind of conditions are most common, where we cannot use safe water to clean food, and when the food really doesn't go through the right screening process and without having good food control systems. Then I was telling you about the zoonosis and the antimicrobial resistance. Why is this important? We've learned the hard way how infectious diseases can cause worldwide tragedies. The COVID-19 pandemic is most likely a zoonosis. It means it's a disease that is transmitted by some animals, and we know that coronavirus are found in bats and to humans. Now, we're not quite clear how this jump in species happened, which was the amplification species, but we certainly have a suspicion that somehow the food system is part of the story. As it's been part of the story in 75% of the infectious diseases we've had in the last 20 years. And that's because humans are encroaching in the environment of these species that are a tank of the different infectious diseases. We are clearing land, which we shouldn't be clearing. We are, creating, expanding our land for growing through deforestation. We are building roads, mines, increasing our cities, but also we're using the wildlife in different ways. We have trade of wildlife species. We kill wildlife in traditional food markets in an unsafe way. And also in high-income countries, we use intensive farming practices, which are also associated to increased zoonotic diseases. Antimicrobial resistance comes as a result of excess use of antibiotics. And 75% of the world antibiotics are actually due to its use in intensive livestock farming, and actually poultry farming as well. And what happens, these antibiotics get washed in the environment, and antimicrobial resistance is very common in the animals themselves, in the workers, and then in the overall population. And this is due to very variable practices. I was actually quite interested to see that, for example, in Sweden, and the green one is the use of antimicrobials in animal farming and blue in humans. In Sweden, you're actually very good because the use of antibiotics, a bit down the line here, the third but last, is very low. And if you compare with other countries like Italy, Spain, or Cyprus, there's a much greater use of antimicrobial. The other important area is the environmental contamination caused by food system. Particularly, I'd like to emphasize the use of nitrogen and phosphorus in fertilizers. And this goes away in water. It actually creates also important environmental impact called eutrophication. So you have an overgrowth of algae in waters, and that has an effect on fish, for example. But then the exposure to endocrine disrupting chemicals, particularly organophosphatic pesticides, heavy metal contamination, nitrogen-based air pollution, and then, the big issue of the production of CO2. And here, I'd like to spend a little bit more time. There's been a very interesting report, which if you have not already read, I invite you to read, produced by Intergovernmental Panel on Climate Change in 2019, really talking about this bidirectional relation between food system and climate change. I'm sure that Patricia will tell you more about some of these impacts, but just here to say that, of course, climate change is producing an impact on food insecurity, but the way we eat, and now I think, we all know that, but we still have not changed our way of life to reduce this impact of the food system on climate change, which is an impact particularly on the greenhouse gas emissions, but is also in general an impact on the way the resources are used. The greenhouse gas emissions are only second of the food system, are only second to the one of the energy system. About 24%, varying according to the estimates, but let's say between 1/4 and 1/3 of the greenhouse gas emissions, whereas agriculture can actually be a solution to this problem. So that's the first one. But then the other one is the use of water. Using the system, food system uses about 2/3 of fresh water. And then it uses a lot of land. It uses 1/3 of the land. If we continue with the current diet, we will not be able to feed the whole world, the whole 10 billion people that we will be in 2050, because we will exceed all these planetary boundaries. We will exceed the acceptable limit of greenhouse gas emissions. We will exceed the acceptable limits of cropland use, freshwater use, and nitrogen and phosphorus applications. So this is really a sign that a dramatic food system transformation is required. And then the last pathway is health of food workers. And let's not forget about that. These are numbers which are calculated by a beautiful report, which I also invite you to read, 2017 report by IPES Food. And the calculation was that about 170,000 deaths every year take place in the agricultural system, and about 24,000 deaths in the fisheries. About 200,000 workers die every year as a result of unsafe food conditions. And you have a list there: acute pesticide poisoning, again, endocrine disrupting chemicals, other kinds of airborne substances, zoonotic diseases, antimicrobial resistance, risks due to injuries during the food processing, distribution, and the collection of, let alone the stressful mental health conditions. Now, this is about summit. This summit is about solutions. Do we have solutions there? And the answer is definitely yes, there are solutions. The same way we have created the problem, we can have solutions. But these solutions need to be found in multiple leverages in the society, the governance and the policy being the key one. So this is about, of course, our own individual changes. This is about adopting a healthy and sustainable diet, but it's about changes in the governance, and it's about developing a completely new idea of how a food system can be structured and can work. These solutions need to be found across the different spectrum of the food system. So in the food supply chain, in the food environment, and in the consumer behavior. And we do have a number of important policies that can be used. In the food supply part, just as an example. And again, please read this year's report of the State of Food Security and Nutrition that gives a very detailed analysis of the kind of investment that is done in subsidies. $600 billion investment done in different forms of subsidies. They can be reoriented towards a more sustainable food system. But then policies in the food environment, and then policies at the consumer's level. And at the heart of it is a concept. The concept of a sustainable, healthy diet. And this is the definition that FAO and WHO have given recently. Sustainable, healthy diets are dietary patterns that promote all dimensions of individuals' health and well-being. So health, of course, comes first. Of low environmental pressure and impact, are accessible, affordable, safe, and equitable, and are culturally acceptable. So there is this element of society. I think this meeting will discuss a lot about societies and equity of access. We don't have equity of access. 3.1 billion people in the world cannot afford a healthy diet. Now, what does it mean in concrete? I mean, this is a very interesting example which has been a lot discussed, but it's a very concrete, useful example on what a sustainable, healthy diet can mean in practice. And it's something that all cultures in the world can adopt. Basically, it's reducing the consumption of animal source food, but in a way that still covers the need. And we do have certain parts of the world, as I'm sure Namukolo will tell you, that actually do need even more animal source food. So it's a balanced way of consumption of animal source food. Do we have actions? And this is a list of policies that WHO recommends in the context of the food system transformation. First of all, reformulating products and having less salt, less sugars, eliminating trans fat, having healthier fats, and having more nutritious food. Second is getting the price right and increasing the price of unhealthy food items, for example, through taxation of sugar-sweetened beverages, but also providing the subsidies that would allow, for example, fruit and vegetables to be more affordable to more. Third, perhaps, really this is an incredible area for development, is public food procurement, getting the right food on the tables of children in school, of people working in public canteens, in the army, in the hospitals, which would not only benefit those who eat those foods, but the whole supply system that will actually encourage the production of healthier foods. We eat a lot of processed food. In certain countries, up to 60% of the food we eat is actually processed and packaged. Having a clear system that everybody can understand on those packages is a very important thing to do. Front of the pack labeling. Micronutrients, if there's 2 billion people with micronutrient deficiencies, actually we need to get back some of the micronutrients in the food system. We've used fortification for a number of years. This is the time now to make fortification adequate, appropriate, and really to be added to all staple foods. Last but not least, avoiding that there is a misalignment between the marketing pressure and the dietary guidelines. So we should not allow that products that should be consumed less to be heavily marketed particularly to children. Food safety. There is a good strategy for food safety that WHO has developed. Basically, this is about having food control systems everywhere. And I'd like to close by reminding us that last year, the UN Secretary General convened a UN Food Systems Summit, and the summit was concluded that these are the dimensions of change of the food systems: nourishing all people, boosting nature-based solutions, equitable livelihoods, resilience to shocks and stresses, accelerating the means of implementation. And many partners have come together to try and do this. We have created these alliances and coalitions, and there's one coalition that Sweden is actually part of, a coalition for action on healthy diets from sustainable food system for children and all, where the objective is really to join forces, exchange experiences, promote action and investment in these action areas: food supply, food environment, valuing food. This is the promise for the future, and I hope that a meeting like this today will allow us to have more ideas and more energy to work on this very important task. Thank you very much.
Thank you very much for a very great overview and your presentation. Thank you. I would like to ask, would you say is it even reasonable to separate health issues that come from sort of typical, this is a new question, we didn't talk about this. but I think sometimes we separate, in our society we separate things. So it's like medical issues is something and environmental issues is something else. But from your presentation, I feel like this separation is actually not functional.
We have been using a concept of One Health since probably a couple of centuries without really mainstreaming it. And I think, you know, maybe as a result of the pandemic, we have understood that unless there is a full understanding of the interaction between the health of humans, that of animals, and that of the planet, we're not going to solve the problem. So absolutely, this is absolutely required. We cannot protect the health of humans without protecting the health of the other beings, live beings in the planet. There is a circular relationship.
Yeah. Thank you. I think we will leave it at that. You will hear all the time, so there's plenty of time to also interact, and you will be part of one of the workshops as well.
Yes.
So, thank you very much.
Thank you.
So, with that great talk, we will now take the next step to our next and welcome our next guest, Dr. Patricia Fracassi, Senior Nutrition and Food Systems Officer at the Food and Nutrition Division at FAO. Warmly welcome. And you will speak under the title Biodiversity and Healthy Diets, 2 Levers for Transforming Agri-Food Systems in the Context of Climate Change. So it very much links, it continues where we were. Welcome.
Thank you so much for inviting me, and it's a beautiful venue, and the program really looks very interesting. I'm very grateful to be here, and I'm happy to talk after Francesco, after such a beautiful overview. So I will talk about biodiversity and healthy diets as the 2 levers for transforming food system in the context of climate change. So why do we want to use a food system approach? So we know that poor diets are contributing to all forms of malnutrition, and we know that policy making and the design of programs is constrained often by an insufficient understanding of the drivers of supply and demand of safe and nutritious food as part of healthy diets. So a food system approach can help to identify entry points for actions by identifying those factors which have the greatest relative impact on facilitating change in a local context. So humankind is facing a perfect storm of climate change, biodiversity loss, and multiple forms of malnutrition. We have seen that these forms of malnutrition are happening simultaneously, and therefore it's really important to look at it in their complexity. Climate change, biodiversity loss, and land degradation impact the food availability, quality, and safety through the loss of nutrients, but also to the increasing threat of mycotoxin. They also affect the stability of food through the reduction of variation of breed crops to withstand climate change. We know that 3.1 billion of people were unable to afford a healthy diet in 2020, and we have yet to receive the new statistic on the number. We think that this number will increase. So we know that food is at the center of climate change, biodiversity, and nutrition. We know the challenge in each one of these areas, but what we are missing is really to look at the connections and to really reposition food at the center of the discourse. So we need to reposition the availability, accessibility, and affordability of a variety of safe and nutritious food that are central to healthy diets. But we need also to consider special nutrition needs of population groups. So really looking at the needs of young children, pregnant and breastfeeding mothers, older adults, as well as a population group in high food insecurity for the prevention of malnutrition in all its forms. So this slide shows the cost of food. So some of the challenges that are happening at the moment. We know that the consumption expenditures shows that the poorest are the hardest hit by food prices rise, as 50% of their income goes on food expenditure, especially on low-income countries. We know also that staple intake is closely dependent on the level of income. So nutritious food are more expensive, and what is happening everywhere in the world is that there is a rapid transition towards nutrient-dense food that are also that are rich in calories and low in nutrients. And this transition is not only happening in high-income countries. We see it happening in low-income countries and in rural areas as well as urban areas. We know also that 3 crops, wheat, rice, and maize, provide almost half of the global dietary energy supply. And the recent crisis, the war in Ukraine, is also showing the dependency of countries on the import of wheat. So we know that 36 countries are highly dependent on wheat from Russia and Ukraine, with some countries having as high as 100% wheat dependency. And to add to that, 3/4 of the people that are living in high food insecurity are also living in areas that are affected by conflict, in addition to other issues such as economic downturn and climate change. So these are some of the, let's say, of the factors underpinning the unaffordability of healthy diet. So the starting point to apply an agri-food system perspective from the ecosystem supporting food production all the way to the actual consumption and disposal of food is to look at biodiversity and healthy diets as the key levers to improve nutrition outcomes and also optimize the environmental sustainability. In FAO, we have developed a theory of change to recognize the importance of agri-food systems that are also inclusive of the most vulnerable people and are also resilient to shock and stresses. So the theory of change recognizes that if biodiversity within and across terrestrial, marine, and other aquatic ecosystem is protected and promoted as the foundation of healthy diets through agroecological, people-centered approach, then a wider range of sustainable production system will be incentivized, and as a result, a variety of safe and nutritious food will be made more accessible and affordable throughout the year. This theory of change recognizes that determinants of food choices are driven by accessibility and affordability. And this is critical to understand both the supply and the demand of safe and nutritious food, especially in low-income areas or low-income settings across the world. So these are a number of entry points in the agri-food system that have been identified to both improve biodiversity and diet in the context of climate change, adaptation, and mitigation. Here I want to talk about two examples of large-scale investments in agriculture and explore how the application of an agri-food system perspective can help to advance a more just transition that benefits the health of the people, especially the most vulnerable, while respecting the environment. I will talk more about adaptation strategies in the context of low-income countries. And this is especially in view of the current food and nutrition crisis and ahead of the global humanitarian overview numbers that in December will show the extent of the crisis. So I will take two examples. The first one is about enriching the nutrient content of staple crop. And here we are looking at in the context of low-income rural setting with high prevalence and burden of child undernutrition, including micronutrient deficiencies. The aim is to promote nutrient-enriched crop with a focus on commonly consumed staples to address dietary deficiency. And I'm taking this example given the decline in productivity in Africa due to climate stressors, biodiversity loss, and environmental degradation, which raises the question on the nutritional quality of the produced staple. And as an example of a large-scale investment, I will look especially at the announced African Development Bank 1.5 billion emergency food production facility that aims to boost the productivity of 4 staple crops. In this case, what we are interested in is to see a shift to go beyond the focus on productivity and increase the nutritional value of the investment for healthier diets while preserving biodiversity. So we are looking at this example using the agri-food system approach that I mentioned before. While the entry point is the crop improvement, we know that the technique to enrich the nutrient content of stable crop is based, first of all, on the selection of endogenous varieties that are resistant to climate change. And second, the nutritional improvement is done through traditional plant breeding techniques. Again, by applying this within an agroecological context, there is emphasis that is put on other aspects of the ecosystem. So the soil preservation and management techniques, as well as water sustainable management. So it's not only looking at the seed variety, but really looking at the context of production. What is being promoted here is the replacement of commonly produced staple with varieties that are nutritionally enriched and can be used by the producer household. But we know that there is a risk in the promotion of enriched nutrient content of staples. And the risk is that we cannot replace one staple food with the variety of the diet. So this kind of measure needs to be seen in the context of promoting diversified diet and seeing how this kind of support or this kind of investment can be compensated and balanced by other measures that are improving the diversification of household production. And there is a discussion on how to scale up support for micro-gardening, how to ensure that certain fresh products, fresh food, are available throughout the year by, for example, supporting households to improve storage, handling, and minimal processing. So this is not coming as a unique solution, but in this case, as I mentioned, we are really focusing on a very specific shift to see how the staple food can become more nutritionally valuable and not only looking at the productivity of certain crop. The second example I'm giving is about sustained access to milk during the food and nutrition crisis, especially in arid and semi-arid lands. Here I'm taking the example of Kenya, a context of pastoralist population with high prevalence of seasonal malnutrition. And the aim is to reduce the risk of acute malnutrition through improved livestock management. The example here is again a large-scale investment, and we are particularly interested at the announced US humanitarian and development assistance of nearly 1.3 billion. And the shift of interest would be to be able to closely link farming and agriculture support with nutritional support, with health support and protection of women by ensuring the full participation of vulnerable households. And how can we do that in a way that we can bring these synergies and this convergence of interest? Again, we are looking at this example following a food system approach. So we know that the livestock is of importance in local diets, and the livestock has a crucial role in relation to biodiversity and ecosystem services in areas that are less suited to crop production, such as arid and semi-arid lands. In this example, we need to consider what type of livestock is more likely to stay with the household. So it's not only the, let's say that the livestock is important, but what type of livestock will be most beneficial to the vulnerable household, and especially to vulnerable individuals such as women and children. Hence the focus on small animal husbandry and small ruminants in particular sheep and goat. So while in theory this model seems to be useful to support, on the one hand, the biodiversity and on the other, healthier diets, we see that there are a number of challenges in the operationalization. First of all, it is hard to ensure that small ruminants receive the same attention as large ruminants, and the same funding in terms of looking at the feed and the water availability, as well as the veterinary support. So the risk is when you present this kind of more nutritionally oriented livestock support, the risk is that it becomes marginal to other types of discussion and investment put in place. At the same time, we know that only focusing on the production side will not help in ensuring the healthier diets and increase the consumption of milk among children. So the example that I mentioned before, the case study in Kenya, looked both at the support in terms of animal husbandry, as well as the support in terms of nutrition and food counseling, with attention to practices for feeding and also for hygiene at household level. So back to the announced support by USAID of 1.3 billion, what we really want to look here by using a food system approach is that we close the link between farming and agricultural support with attention to the nutritional support, health support, and a focus on women. So there are some final considerations that I would like to bring to your attention. So one is that by keeping biodiversity and healthy diets as the two levers for transformation, we see the extent to which any entry point can trigger considerations on policy and actions across the agri-food system. The other one is that working with an agri-food system perspective requires to bring in other discipline, to bring in other stakeholders with sometimes different priorities and different agenda. So rather than closing up, we need to embrace what appears to be at times chaotic or even conflicting, and ensure that we embrace the emerging trade-off and we make them fully part of a discussion. And transformation can only be achieved through this continuous dialogue and really looking at the most promising context-specific solutions. Thank you so much.
So much, Patricia. Given the nexus you describe with biodiversity and health, how do you see and how do FIO work considering indigenous people's role as stewards? This is not specific to food, but it said that they are the stewards of 80% of the world's biodiversity. So is that something that you could reflect on?
Yeah, I think it's, I mean, the inclusion of indigenous people, it's fundamental to really see that nexus between biodiversity, food system, and healthy diets. And in fact, when you bring in indigenous people, they really tell you how much food system starts with the ecology and with the ecosystem services. And in fact, it was really in FAO, we have a division that works on indigenous people, and they really bring in the voice of diverse networks. And they were the one that said, for example, don't talk about farm to fork, because it's really excluding what the indigenous people are doing because they are gathering, they are harvesting, they are really looking at resources and the use of these resources in the context. So they can bring a very important perspective, and they need to be at the center of this discussion because of that.
And do you also work, considering now the work on the next biodiversity framework, is FAO involved in that?
Yes, yeah, absolutely. There is again, I mean, we have a large division that is working both at climate change, but also biodiversity, and this will be, I think there will be a publication coming out on that very soon.
Thanks, we look forward to that.
Yes.
Thank you very much.
Thank you.
And now, last but not least in this session, we will listen to Dr. Namukolo Covic from International Livestock Research Institute and Director General's representative to Ethiopia in Addis Ababa. Most welcome.
Thank you very much. And thank you very much to the organizers for inviting me to speak at this summit. Yeah, and the first time I've been inside a real castle, so making some personal history here. My presentation is going to focus on food systems transformation, and specifically I will take an African perspective in terms of where we are now and where we could be going instead. I want to start with my key messages to you and then go through the presentation, and hopefully you will still agree at the end that these are my key messages. So the first key message that I have for you is that Africa has multiple food systems challenges. There's plenty of them. I think Patricia did mention some of them. But also that we do have opportunities that we can now leverage, such as the current food systems momentum that we have seen that have been brought about by the UN Food Systems Summit, and the manner in which the continent and the countries on the continent have responded to that. But that for this to actually happen, for us to be able to harness these opportunities that are presenting, we need all actors to actually be more deliberate about the efforts that they make to generate synergies and to be able, as a result of that, to generate some collective momentum, not only within countries, but across the continent. And hopefully, I even dare say, perhaps be a lesson to other parts of the world. So I start with the theme for this summit, which is healthy lives from sustainable food systems, which takes me to what the African continent looks like in terms of outcomes at the moment. We certainly have a double burden of malnutrition. On the undernutrition side, it is reflected by these high levels of stunting that we still see on the continent. We've seen some reductions in averages, continental averages, but not fast enough to reach the SDG targets that we have set. While in the under 5 children, we are doing a little bit better. For exclusive breastfeeding, for example, we are doing not too badly, but we still need to do even better. We can already see, if you look at girls 5 to 19 years old, an increase in prevalence of overweight. When by the time we get to adult women, the situation is actually quite bad and is no different to some of the global north countries. And in some countries like South Africa, Ghana, the levels of overweight and obesity are indeed very high. South Africa tipping the scales around 65% of women overweight or obese. So yes, we have a problem. These are the nutrition outcomes of the prevailing health systems.
And this overweight and obesity just doesn't come like that, because it comes loaded with diet-related non-communicable diseases like diabetes, high blood pressure, and the like, that we are seeing increasing prevalence of. But we are seeing those increases against a background of health systems that are not equipped, as well equipped as those in the global north, to deal with them. So my next item that I want to look at is the fact that Africa's food systems are characterized by multiple challenges, but also strengths that we should leverage with this momentum of food systems transformation that has started. We are quite vulnerable to trade in staple foods. This is from FAO stat data showing how dependent we are on staple food imports. And here I'm showing maize and rice, with the red being the levels of imports that we've been having over the years, and gray line, that gray line showing the deficit. This is the same even for wheat. So you can imagine, with the current food crisis that has emanated from the Ukraine-Russia war, we are extremely vulnerable, and these food prices that are going up are making what was a bad situation even worse. But we are also at the same time working, trying to intensify our agricultural production. And fortunately, that is bringing challenges too, because we are going in the same direction that the global north has gone, where we are bringing on board monocultural practices, bringing on board use of fertilizers for a good reason, but we're doing it at a time when our knowledge systems actually are subject to us being able to use them not so effectively. But then also pesticides are also coming on board. And indeed, on the livestock sector, as we intensify livestock production, I'm using poultry here as an example, the use of antimicrobials and pesticides there as well are increasing. In fact, as I walked in this morning, I met a young man there from Zambia, if you can stand up so they can see you, who said to me he's doing his PhD in Zambia working on antimicrobials in the farming, in the poultry industry in particular. What this is doing is adding residues to our food basket that our standards bureaus are not equipped to handle at the moment. But it also reduces the diversity of our food system. And within this context, the International Livestock Research Institute that I work for and the CGIAR at large are really working to try and find sustainable solutions to be able to increase food production and limit the hazards that may come with that. You've seen the plate of the planetary dietary guide that Francesco showed us earlier. This is what it looks like for the African continent on average. So you can see that for a lot of the nutrient-dense foods, we are not consuming enough. There are some like tubers where we've gone off the scale, but I think that's probably from things like cassava that are consumed in a lot of amount. Beef is at the planetary boundary, but that simply reflects the diversity of the continent. If you take a continental average, while some have very little, there are indeed others that are already tipping the scale. And this is happening in a continent where we still have a very rich food biodiversity. And on this slide, you are seeing caterpillar, mopani worms, you're seeing okra, some dried fish, termite ants, millets and sorghums. So we still have quite a wide biodiversity of food on the continent that we are still consuming. So we haven't let go of the insects yet. We haven't let go of the different types of foods that could add variety depending on what we do with our food systems transformation. Now, you've seen in the Lancet sketch that I showed you that we consume very low amounts of animal source foods. And we are trying to promote consumption of animal source foods, in particular among young children and pregnant and lactating mothers for the nutrient requirements that they have. So when you see at this graph, the percentage growth in demand on livestock products, if you consider sub-Saharan Africa, the SSA fourth bar in each one of those graphs, we are seeing much greater growth in demand than high-income countries. What this implies is that we need sustainable solutions to increase production within the limits of our planet so that we use ourselves, because we are only beginning to increase our productivity levels, we offer an opportunity to take a different trajectory in the types of production practices that we then engage in. And here I want to show an example of the situation of an egg. Seems like, oh yeah, an egg a day for a child, easy, cheap. That is unaffordable. And so we need really to think in terms of what can be done differently in these contexts. And this is an example of a study that was done in Ethiopia between UNICEF, the Addis Ababa University, and others, where they looked at, okay, so if an egg is too expensive, what can we do for complementary feeding? A child, a 7-month-old child does not eat to consume a whole egg. And so producing egg powder, you can now add the egg to the complementary food by the teaspoon. And by doing so, they were able to show that they could reduce the cost of the complementary diet by at least 14%. The question then is, are there others sort of like more sustainable, perhaps innovations that we can think of that can help us get better nutrition, but not necessarily inflating the cost at the same time? So these are areas where we need solutions within the context that we face. This is actually almost a tongue-in-cheek example that I am going to give you. And essentially what I want to paint a picture of is the fact that even on the African continent, we do have people that are already overindulging. And this was a tweet that I saw of somebody, actually an institution, Digital Events, that was inviting people to the Zambia Agricultural Show. And it says, who are you coming with? The food market, and there's a nice plate of food there to attract people to come. So as a nutritionist, I look at that and I go, oh, dietary transition, that's not where we want to go. And so I responded very politely to whoever the person that wrote the tweet was, to say, yummy food, because I love the food that is given there. But for better nutrition and health, the amount of space taken by the sausage and the fish on this plate should be the sausage, should be the vegetables. The space taken by vegetables now should be the sausage and fish. That would contribute to shifting to sustainable consumption patterns. I wasn't sure if the person was going to respond, but they responded to say, thank you very much, we will encourage the people who come to balance their plate better. The point is the fact that while we strive to increase animal source food consumption, we should also balance on the other side, increase energy intake to ensure that our consumption patterns do not swing the pendulum too far. And this offers us an opportunity as a continent to actually do better. So the difficulty that we are in, my own view is we should take it as an opportunity to set a trajectory that can actually do us better on food systems transformation, to bring on board better nutrition and health outcomes. Which means context is always important, and equal treatment is not always what is needed. We need to learn lessons from the global north so that our transition, our transformation process can actually take a different trajectory. So I said we do have opportunities for positive food systems transformation. And these are embedded within the current momentum from the UN Food Systems Summit. Multiple African countries have developed food systems transformation pathways. The African Union has looked at the different transformation pathways and looked at commonalities among them and developed a common position on the UN Food Systems Summit. The opportunity this provides is that we've got multiple countries, and I always remind people that Africa has got 54 countries, 55 depending on who's counting. It's really quite a number of countries, so to be able to get all of them coalesce around one common position on food systems transformation, in my view, is an unprecedented opportunity for us to do better, but that depends on how we leverage this opportunity. Amongst those 55 countries, only 9 currently have food-based dietary guidelines, 3 of which countries are not even happy with the guidelines that they have. I think the fact that we have so few countries with food-based dietary guidelines is not something to be sad about today. Rather, it is an opportunity, because it means the majority of African countries are going to develop their food-based dietary guidelines within this new context of wanting to have food systems transformation where we want better diets in the future. To me, this is an opportunity that we can leverage to actually have guidelines that speak to the current momentum, that speaks to where we want to go. And I use Ethiopia now as an example of this. For the food systems transformation pathway of Ethiopia, this is the vision that has been set to guide that process. A holistic transformation of Ethiopia's food systems from production to consumption that promotes enhanced food safety, nutrition and diets, improved livelihoods, greater land preservation and restoration, and greater resilience to shocks and stress. I'm sure you can hear what Francesco was talking about in his presentation, and you can hear some echoes of what Patricia was talking about earlier as well. They go on to say, we seek to transform our food systems using sustainable and healthy diet-centered lens that minimizes trade-offs through calling for strong collaboration across food systems actors, uniting around a common goal of healthy and sustainable diets for all. Such a vision can be used as a North Star to guide different food systems actors in their efforts to contribute better towards better diets from a transformed food system. And so this is why I'm saying to you that the recent momentum from the UN Food Systems Summit, because of the manner in which countries are responding, could actually be used as an opportunity to set a different trajectory. There is also this framework that emerged out of the UN Food Systems Summit, looking at how we might monitor food systems transformation at country level, but also be able to compare across countries. Different thematic areas, diets, nutrition and health, environment and climate, livelihoods, poverty and equity, and then cross-cutting thematic areas of governance and resilience. This too provides an opportunity for changing trajectories, because it means we can actually have some level of accountability to the transformation promises that we are actually making. Now, for the African continent, this is also being looked at as in the Comprehensive Africa Agriculture Development Program that most African countries are implementing. Their CADIP biannual review process is taking up some of these indicators to include and embed as part of monitoring that common Africa position that I talked about. This, to me, is an unprecedented opportunity for us to be able to do things different. Which brings me back to my key messages again. That indeed, Africa has multiple food systems challenges, but that we also have opportunities that we can leverage, such as the current food systems transformation momentum that could bring about positive change. However, this will take place only if all actors are deliberate about generating synergies for collective momentum. Thank you.
Thank you so much, Namukolo. I have so many questions. Starting off with speaking of context, you said sort of here living in the northern countries, and there's a lot of focus on meat or reducing meat consumption for climate reasons. So given the importance of livestock for many people, especially those in poverty, do you feel that you need to argue for the whole livestock holding in this climate-focused media debate?
Yes, I think we also have, as a continent, we also have a role to play. When you look at charts, it looks like we are not emitting a lot of greenhouse gas emissions. But I think because of the low productivity levels that we have, a glass of milk produces more greenhouse emissions for us than it would here in the global north. So already just by looking at improving our productivity levels, we can actually mitigate greenhouse gas emissions. But at the same time as well, there is work that is taking place looking at greenhouse gas emissions are not the same in every context. So we have people, for example, at the International Livestock Research Institute that are currently estimating greenhouse gas emissions under different contexts. But in addition to that, they are also looking at different feeding regimens as well, different types of forages, because most of our livestock are forage-based. So they're looking at combinations of different forages as well to address greenhouse emissions. So yes, we still do need to leverage the high nutrient density of animal source foods for particularly our children and mothers. But we also need to remember that livestock, for many settings on the African continent, are not raised as food. They are an asset, a bank account. I went to school with my mom saying, that cow for next year's school fees. So there is that level. There is also, I think, Patricia made reference to it. There are many settings in the Horn of Africa, in the Sahel, where crop agriculture is not even an option. So what we need for them is, what are the sustainable livestock solutions that they could depend on? Because the grain that they purchase, they will actually sell livestock to buy wheat, to buy other grains. So they may, even in some of the pastoralist settings, they may also have very low consumption of meat because it's not primarily raised for meat. The second item is the fact that we still have significant swaths of places on the continent where animal draft power is important. Again, in those circumstances, what are the solutions? If you take away the livestock, they won't even produce the crops. So I think it is important to think in terms of context. Yes, greenhouse gas emissions are a real challenge, but let's look at them in context and look for contextual solutions.
Great, thank you. And I will ask you another question also, because I thought it was so interesting when you showed how you're moving from sort of a previous system into a more monocultures, more input system. What is the drive that takes you down this path?
Economics. Primarily, I think it's economics. Agriculture is a livelihood. And so we have transitions from subsistence farming. You can still see all those: subsistence, smallholder, large-scale farmers. And so it's, you want to make your livelihood better, earn more money, you transition. But in that transition, it offers opportunities for us to say, is there a different way of doing things? I mean, here in Europe, you are already experimenting with different ways of raising livestock within the climate context that we face now. The question that I ask is, should we follow in your footsteps, or should we leapfrog to the solutions where you are going? Because those are the things, those are some of the questions that we really need to ask, to say, can we use the level of development that we are at as an opportunity to do better? So that researchers, you want to try out some solutions? We're ready for that. Ethiopia has got a platform they call the Sakota Declaration, which I really love. And essentially, they want to eliminate stunting, but they've taken a food systems approach. And they have said, they started off with an innovation phase where they said to development partners and everybody to say, if you want to try out solution, come, try. I mean, they have to do something anyway, so you might as well try something. And those solutions that are working, they are picking up just like that. Multiple countries are trying to do the same. So for me, the message in an environment like this is that, yes, we're not as highly developed, but that's an opportunity for us to take a positive trajectory in development.
Great. Thank you so much. Thank you to our plenary speakers for this great start of session. We will soon have a break, but before that I will share some information so you know where to go after the coffee break. So, because at 11:30 there are the 5 different workshops starting. You've all been chosen or allocated a workshop, and the route for the workshops are as follows. So, workshop A, food planning for sustainable consumption and healthier living. You will be in here. Riksalen, the shift framework for health, equity and food environment. You are in Johan III, and Johan III is the room that you get to if you go into the door down there. And then the sustainable animal food production in war and peace is in Vasasalen. We can say Vasasalen is sort of straight under us, and you get there by going through this room and down some stairs. There will also be people to show you the way. And then the fourth, the Diet, Environment, Health Nexus is in Galleriet. And Galleriet is the room you can sort of see in there. So it's one floor up. You go up the stairs that you came in through. And that's also where lunch is served later. And then we have the fifth workshop, Zero Hunger, is mixed smallholder farming, the solution. This is a digital workshop, but those of you who are here physically and are joining digitally, if you want, you can go to Segerstedshuset, where it will be sort of held from. And if you want to go there together, you should meet in the reception around 11. But you can also, of course, find a silent corner. Could be difficult here in the castle, but if you want to find somewhere else, if you want to go to your room or so. But that's otherwise go to Segerstedshuset and meet at 11. So around 1 o'clock, all workshops will break for lunch. We will have a little bit separate timing to not create a too long queue in the lunch. And as I said, it's served up in the gallery. And after lunch, the workshops then continue, and we will meet back here in plenary at 4:15. So enjoy your day, enjoy your workshops and conversations, and see you back.